We are a team of 3 medical students working at the University of Groningen, and in collaboration with an expert in the field, we are seeking to determine the best way to personalise treatment for each patient with CLL. And we are seeking to do this with a method that is called BH3.
BH3 is a new profiling technique where we take a patient's blood sample and add some peptides to it, and with this result we can see what will kill each cancer cell. And then with this new information we hope to predict and plan a new treatment for each patient.
CLL, also known as chronic lymphocytic leukemia, is a cancer of the blood. More specifically, it is a cancer of the B cells of your immune system. Normally, these cells protect your body against small infections. However, in this cancer, something goes wrong which causes these cells to behave abnormally. Now, although this cancer generally only occurs in the older generation, it is still the most common type of leukemia in the world. One of the problems that we're currently facing with CLL treatment is the fact that whilst one patient may react to one drug, another patient may react to a completely different sort of drug. And because every cancer is very different, it is very difficult for us to predict which treatment may work for a certain patient.
We are very excited about the future implications of BH3 profiling, and there's 2 ways we would like to use them. And the one is for patients that have become resistant to their therapy, so we could see if their profiling has changed maybe, and to which medications they will still be sensitive. And the other thing I think, which is something that is going to show that it's very cost effective, if new medications come out for CLL, we can test them with BH3 profiling and see which patients they would work on.
This is a short tutorial explaining how personalized medicine can completely revolutionize the way chronic lymphocytic leukemia, also known as CLL, can be treated in the clinic. I will start off by explaining how it currently works. On any particular day, dozens of patients may come to the clinic with CLL. All of them obviously look very different, but in fact, their cancers are actually very different as well. But there is absolutely no way for the doctor to know which patient has which type of cancer. What that means is that the doctor will just prescribe the first-line drug written in the guidelines. This means that everyone gets the same drug, but not everyone will tolerate the drug very well, which means that some patients may suffer from side effects that are completely unnecessary. And there is absolutely no way of knowing what these side effects will be and how long they will last before the drug is given to the patients. This is exactly the problem that personalized medicine wants to solve. Just imagine, the same patients come to the clinic again, all of them obviously very different, with different types of cancers as well. But this time, there is someone in the lab who collects a sample of their blood and tests it with a groundbreaking BH3 protocol. With this protocol, this lab person can predict which drug will work best for each patient and prescribe that particular drug. What this means is that no one will suffer from unnecessary side effects which can be prevented early on. And this way, our protocol is going to solve the unnecessary side effects that the current CLL treatment has. We call this BH3. Do you agree with BH3?
I agree with BH3.
I agree with BH3.
I agree with BH3.